joining. Okay. All right, and we are recording, so I will go ahead and get started. Good morning, everyone, and welcome to NCRAN's February 2025 webinar. I am Erin Martinez, and I'm an associate professor and extension specialist at Kansas State University, and have been a longtime member of the North Central Region Aging Network. And we are so excited today to bring to you a new topic for the North Central Region Aging Network series, which is all about horticulture and elevating well-being through gardening. So I'm very excited to have my colleagues from Kansas State joining us, Dr. Cynthia Domangini and Annie Baker. So I will pass it off to them, and then I will see you at the end and give you the link for our evaluation survey and remind you about next month's webinar as well. So I will pass it off to our presenters. Thank you for being here today.
All right, good morning, everybody. And thank you for the opportunity to participate in this webinar. Annie and I are going to be talking about one of my favorite topics, so I hope to not get too long-winded. And I always encourage a discussion, the discussion to continue once we finish our presentation. I am going to see if I can move those pictures out of the way. There we go. Okay, so I always like to start off by saying a thank you and sharing just a little bit about myself, so you know who's talking to you during this webinar. As Erin said, I have a background in therapeutic horticulture. My name is Cynthia Domangini, and I am an extension specialist here at Kansas State University in the Department of Horticulture and Natural Resources. I also have a teaching appointment, and I'm very excited that we have recently been able to start offering online classes in the area of therapeutic horticulture. So that's going to be one of the primary focus of what I'm talking with you about today. And of course, as a mom, I shamelessly squeeze my children into just about every presentation I give. So you can see my lovely family here, and I'm just happy to be with you today. All right, so we'll go ahead and get started. So why garden? Gardening benefits our personal health in a lot of different ways, and there's been plenty of research that's been done to show that plants contribute to a healthier diet. When we grow more fruits and vegetables, we eat more fruits and vegetables. But interestingly, plants have also been shown to help us heal faster. There's been studies that have shown that patients in hospitals that have access to plants or even views of plants heal more quickly and report less pain, and actually take less pain medications while they're in recovery, which is a very interesting connection to plants. Gardening also can serve as a form of exercise, so it can help improve muscle mass and hand dexterity, among many other physical benefits. Looking at this chart, you can see some of the areas of physical activity that gardening can accomplish. So if you look at the left-hand column, you'll see different gardening tasks. And the center column, where it's titled MET, stands for metabolic equivalent. And then on the right-hand side, you'll see intensity. So the METs are a level of how, or a measurement of how intense each gardening activity is. And then we tend to report that information as low or light to moderate to vigorous in terms of how much physical activity is obtained. So you can see there's a number of tasks on the left-hand side that actually count for a moderate form of physical activity, including weeding, one of our favorites, right? Digging, let's see, fertilizing. I imagine there's There's different ways to fertilize. So some of those are going to be more physically intense than others. And then, of course, raking. We've all just recovered from a lot of that this fall, and we're probably about to do some more of it as we prepare for spring planting. So it's a great way. Gardening can be a great way to get in exercise without feeling like you're exercising. So that's one of the nice benefits that gardening can provide. But garden also contributes to improving our mental health. Older gardeners especially have reported less stress when they participate in a gardening program. And research supports the use of gardens to help clients maintain their cognitive functioning. Gardening is a social activity. Tasks in the garden can be modified to increase socialization or even target socialization if that's the purpose of the program. Individuals who participate in gardening, and even those who have their own plants to care for have reported a greater sense of value. They have a purpose as they're providing for those plants. Residents may feel an increased sense of belonging by participating in a group garden. They are contributing to that space, and so they feel more invested in it. And gardening has also been shown to help build self-esteem as participants are successful with different gardening tasks. There is great value to the garden and also just having access to green space, especially when we think about our older adult population. Research supports having access available to green spaces for all ages, but in that older adult setting, it's actually been linked to increased survival and a more positive attitude towards their own community. So now we're going to talk a little bit more specifically about therapeutic horticulture. Therapeutic horticulture is a term that's used to describe an active or passive use of horticulture-based activities for their therapeutic value. Participants in a therapeutic horticulture program typically have an identified need, whether it's a medical diagnosis, but it could just be a desire to enhance their well-being. Therapeutic horticulture programming is organized by someone with expertise in the fields of horticulture and human health to target the benefits that can be achieved through those plant interactions. Now, on the slide, it says a registered horticulture therapist. That's certainly not a requirement, but the person who is offering therapeutic horticulture should have some understanding of how to use plants for the purpose of enhancing well-being. Therapeutic horticulture programs could be indoors or out. It does not require a traditional garden for the benefits to be received or accomplished. We're going to talk about therapeutic gardens for a bit that can be designed for the purpose of achieving that therapeutic value. So for a garden to be therapeutic, it needs to be designed with the participants as the focus. The purpose of the space should be considered in terms of whether the garden is going to be used for rehabilitation. Is it going to be for vocational purposes? Is it going to be a place for older adults or children? All of those considerations should be thought of when you're actually designing a garden for therapeutic purposes. The needs of the participants should be considered in order to make sure that the garden space is safe, but also so that the goals of those participants can be accommodated. And of course, we want to facilitate people-plant interactions. So the garden design needs to enable people to interact with the plants as they visit that space. So what I'm describing when I talk about a therapeutic garden is actually something called an accessible garden. And an accessible garden is one that's designed to allow people of all ages and abilities to enjoy and participate in their gardening experience. And maybe you're familiar with the term universal design. That term is not specific to gardening, but it's commonly used when people are designing an accessible garden. The universal design is not a targeted approach specific to individuals with disabilities or differently abled, but it's an environment that's created to allow everyone to benefit and everyone to enjoy that space. It's universal. Accessible gardening is important because it makes the garden safe, as I mentioned. Everyone's able to participate, everyone's able to have success in the garden, which is so important for therapeutic purposes, especially. Participants are able to feel like they belong and they're able to enjoy their time in the garden rather than focusing on how am I going to adapt this space to make it so I can come and participate. How am I going to make it to that garden way out there when it's hot outside? Those kinds of decisions are stressful. So an accessible garden takes away the stress of the participant having to make adaptations. The garden's already adapted to meet their needs. There are many ways to create an accessible garden for any population. So as I already mentioned, this does not need to be a traditional in-ground garden. And here's one example. As I mentioned, I like to squeeze my family into my presentations. And so this example is actually my grandmother's garden. She is about to turn 98 years old, and she lives in Washington. This is the garden that she created on her patio at her assisted living center. And she is growing entirely in containers. Container gardening is a great way to accommodate many different needs. For example, people who aren't able to visit an outdoor garden, smaller containers can be moved indoors during gardening sessions to bring the garden to them. Containers can be grown under a cover to provide shade, but also protection from weather, making it so the space is more accessible. Containers can be brought up to a table space so participants can garden while sitting down or even garden while standing rather than having to be bent over. And one of the great benefits of gardening in containers is the maintenance is very low, much lower than a traditional in-ground garden. Here's a few more examples of container gardens using different decorative containers. Don't feel limited with this style of gardening by the containers that are available at garden centers. You can create a container garden out of just about anything. And you'll notice that in the picture on the left, this is one of my gardens where I've planted flowers in an old wheelbarrow. And then here's a window box in the center photo that is really quite lovely. There's a lot of different plants grown in that one container, but it's still small enough that you are able to move it as needed. And then the photo on the right shows some containers that were actually built by the garden area just using scrap wood. So containers can be created out of many different materials, and then they can be used to brighten up spaces indoors and out. Vertical gardening is another creative way to make gardening more accessible. One of the more well-known, probably, vertical garden styles is using a trellis and allowing plants to climb up the sides and even the top of the trellis sometimes. But there are many, many, many other types of vertical garden options that can be purchased, such as the one shown on this slide. This is an example of what's called a pocket planter, and each of those pockets is sold separately, and then you can purchase many of them and put them together to create a living wall in a vertical space, hang it on a fence. Vertical gardening is a great option because it makes a really beautiful display, as you can see in this slide, but it also can be supported in a way that gardeners can sit while maintaining the space side by side with someone who's standing while they're gardening. And again, that brings that social connection and makes the space more accessible, so that it's not all the seated gardeners have to go over here and garden in this space, and all the standing gardeners come over here. Everybody's able to garden together, which is really lovely for accessible gardening. Here are some other examples of vertical gardens. You can see the photo on the left. They took several window boxes probably and stacked those in a creative way to create that vertical garden. The one just below that is actually using recycled containers that have been attached to a wall. So that's a more inexpensive option. And then the remaining two photos are constructed out of wood. The one on the far right is one I built out of a pallet, just to experiment with trying to grow plants in another way. And that creativity can be a lot of fun, getting participants involved with problem solving. How are we going to cover this ugly wall? And how are we going to make it so we can garden with the least amount of maintenance? And what kinds of plants would we be able to grow in that space? All of those are really great ways to build investment in the program, but also to increase the participants' feeling of worth and value. Okay, here you go again. I'm squeezing my kids in this presentation. Y'all are going to be sick of me and my family. Okay, so here's a few more examples of vertical garden examples. And I wanted to bring this in because I don't want you to ever feel limited on how much money you have to do this program. This can be done very affordably. So the picture on the far right, which is my son when he's 4, he's standing in front of a shoe organizer, actually. This is something that people buy, I guess, to hang on a closet door and then tuck their shoes into those pockets. Well, we planted some herbs. We experimented with planting strawberries and green beans, but that wasn't a great idea because they needed more space to spread out. So this is the type of project you would want to use smaller rooted plants that aren't going to spread very much. But that's what we did. We used a shoe organizer for that project. And then the photo in the center is my son all grown up at 17 years old, standing in front of a pocket planter that he actually built out of weed fabric. So each of the pockets is weed fabric sewn into the pocket shape, and then it can hang on the wall. So that had very minimal cost. And then the photo on the far left is actually at a restaurant in Kansas City, and they took some metal containers for some purpose. I don't know what the purpose was, but they drilled a few holes in the bottom and hung a few together, and it created a really beautiful vertical garden. Raised beds are a common accessible gardening feature you're probably familiar with. Just like with container gardens, there are plenty of options in what types of materials can be used to create a raised bed. They could be purchased, like the one on the left, and can be designed to accommodate seated gardeners or standing gardeners. The raised bed in the center is another DIY project that it was made out of that weed fabric sewn in a cylindrical shape and then filled with soil. The problem with that is it got very, very heavy and not easy to move because of the material. The material was not very strong. So put that one where you want it to go and leave it there when you fill it with soil. It's there for the season, basically. And then the one on the right is actually made from a metal water trough that had rusted out on the bottom. So we turned it into a raised bed. The raised bed dimensions are something you want to consider to make the space accessible. They should allow the gardener to easily access the plants in the center of the bed. So the width should be no more than 4 feet across if there is access all the way around the planter. Easy access raised beds are 3 feet or more in height. A standing gardener does not have to stoop over to garden in that height, and the work surface is no lower than their fingertips. So that makes it easier for them to garden in that space. For seated gardeners, raised beds, for seated gardeners who want to use a raised bed space, they tend to be about 2 feet high, and you can see in that photo on the left, you'll want a space for them to pull up underneath the raised bed. Here are a few more examples of raised beds that have been constructed out of wood, and you can see the one in the center has that space for a chair to pull up underneath it and allow seated gardening side by side with someone who would be standing while gardening. When we talk about accessible gardening, we have to consider other options as well, or other factors as well. Pathways are a very big consideration. This goes back to keeping the participants safe. So the pathways should be smooth and level, and ideally a hard surface. These features make it safe to navigate without having trip hazards. So the pathways ideally should be 3 to 4 feet wide, and that allows access for someone who is in a wheelchair, but also someone who may need assistance from somebody walking beside them. It allows 2 people to walk side by side. Also including an area for a wheelchair to turn. So either a circular area, or as the photo on both of these photos show, a way to navigate and make a circle to go back the direction you came from. When you're talking about surfaces, you also want to think about what will happen in the rain. How slippery will that surface get, and choose accordingly to reduce that. Another feature in accessible gardening is areas for rest and reflection. Having a space to sit and relax and rest will help participants prevent stress and injury, but also it encourages people to come and visit the garden just for enjoyment, just to sit and enjoy the space. Comfortable seating should be available in a shaded area, so that on those warmer sunny days, they can still access the space and also get out of the sun. You want to make sure that the chairs are stable and smooth to prevent splinters, injury. The photo on the left is actually not a great option for an older adult garden, accessible garden. Not only are those benches really not that comfortable, they might be cute, but they're not that comfortable. They're also not always very stable. You'll also notice that that white bench is on an area of mulch, which makes it less accessible. Accessible gardens should be flexible to meet the needs of every gardener. I've mentioned a couple of different ways of doing raised beds, so you could have seated gardeners and standing gardeners. The garden should be simple so that it's not overwhelming, and so that participating doesn't require a lot of instructions. They should be safe and free from hazards. The next few slides that we're going to go through will show some examples of gardens and features that are in line with that universal design, as well as some that could be improved. So look at the photo on the left, and you can see that this is a simple design of a garden that is easily accessible, whether sitting or standing. You can't see it, but the paved surface makes it so that people can get to that space hopefully without too many trip hazards. The garden on the right is lovely, but you'll notice the approach to it is grass. And that may be okay depending on who your participants are, but it is less accessible than a paved surface. So look at these two garden examples, and you are probably noticing one of the most obvious differences. The garden on the left is a hard surface using pavers, and the one on the right has loose gravel. Loose gravel is obviously going to be a problem for anybody that's using an assistive device while walking. So the one on the left would be considered more accessible. You'll also notice the simplicity of the garden on the left. A single raised bed of that size is very easy to maintain, but still giving participants the opportunity to interact with plants. Here's another couple of examples to look at. The space on the left has a nice pergola covering to provide some shade. And there's a raised bed tucked back in there, so the participants can still be outdoors enjoying the fresh air, but not out in the intense sunlight. There's a nice large paved area there for participants of all abilities. The one on the right is a very narrow pathway. It is paved, but it's very narrow, so it's not as accessible. It's beautiful. And this is just a private residential garden to illustrate the point of making those pathways wide enough for everyone to enjoy. Okay, and one more example. The garden on the left is a really great example of raised beds at different heights to accommodate young gardeners on the far right, to seated gardeners in the center, and then adult standing gardeners on the left. Everyone gardening side by side. It's beautiful. It's got a paved surface that's level. There's some shade over to the right. The garden on the right has steps up to the center area and even up to the back area. So that makes it impossible for gardeners to visit that area if they're not able to walk up steps. All right, so when we're talking about accessible gardening, we have to talk about plant selection. The most important thing to remember with plant selection is choosing the right plants for the environment. And the reason this is so important is because it is going to minimize the amount of maintenance you have to do to give the garden the best chance for survival. Start with healthy plants that are disease-free from a reputable source. Those are 3 other important features. Understand how much time you will have available to maintain these plants, and choose plants that are going to, choose plants that are going to tolerate the amount of time that you have. So the list of plants to consider is extensive, but here are some categories to consider. Herbs are great for accessible gardens because they tend to be low maintenance, especially once they're established. Vegetables are a great option for obvious nutrition benefits, as well as the joy of consuming the produce that you grow. Succulents are a really good consideration, especially if you're going to be doing container gardening and some indoor gardening. They require minimal care, and there's so many different varieties. Flowers are very popular, as gardeners can make their own bouquets out of their harvest and enjoy the plants indoors as well. There are also connections that gardeners can make to the past, to their childhood even, by growing some of those heirloom varieties. And then, of course, climbing plants, which are a great choice for vertical gardens. Sensory plants are a collection of plants that appeal to one or more of the senses. It's particularly beneficial to include a sensory garden when you are working with individuals who are affected by one or more of those senses, so they will still be able to enjoy the garden using their other senses. So some garden accessories that you may consider in addition to careful plant selection are bird feeders to invite that extra color and sound into the garden. Wind chimes also increase sensory interest by the sound that they create as the wind blows. There's also a list of plants that you should avoid when you're talking about accessible gardening, and that list could be very long as well. The criteria for whether or not a plant is appropriate for your garden depends on the growing conditions, but also the goals for the program. First, you want to avoid plants that don't meet the needs of the gardeners and staff who are involved with the garden. So that could be because of the level of maintenance, but it could also be because of allergies or other sensitivities to certain plants. Plants with thorns, even roses, could be dangerous for individuals who are affected by their sight or maybe have poor balance. If gardeners are at risk for consuming plants without permission, then any plants that are toxic should be avoided. Similarly, if gardeners may not follow safety protocols, you want to avoid plants that could injure their skin if they're touched. And then it could always consider low maintenance plants and avoid any that may become invasive. Accessible gardening also includes adaptive tools, that there are a plethora of tools available for purchase online there or in your local garden center, but there are also adaptations you can make to certain tools. You want to consider long handled tools for standing gardeners, but also, as you see in this photo, some of the tools can be made where they are lightweight but still long handled, so gardeners can use it while in a seated position. Using bright colored handles makes it easier to locate the tools. And then having options for benches such as the garden seat here on the right, makes it possible for gardeners to roll through the garden bed and still participate in the tasks. You also want to consider access to water, having at least one water source in an accessible area. And then you can provide water containers to transport water if needed. Storing the hose at an accessible height, about 40 inches or so from the ground, makes it so that the participants can be involved with that gardening task by watering the plants. And then having tool storage nearby is another feature of accessible gardening. Storing the garden tools together in a variety of sizes, make sure that the safe tools are accessible and not out of reach, but tools that are not safe, keep in another location to protect your gardeners. Having a workspace available for potting plants, doing crafts, planting seeds, and even garden crafts. I said garden crafts. Those are all considerations that you want to be keeping in mind for accessible gardening. Especially if you're working indoors, you want to avoid a room with carpet and planting seeds, obviously. That's going to be a mess. That's going to not bode well for the continuation of your program. So thinking about where you're going to carry out your programming. As I mentioned before, gardening can be a great social activity, even if the residents or participants aren't physically gardening. I mentioned already that therapeutic horticulture could be active or passive. A garden setting can provide a nice spot for an afternoon tea or another social event. The participants don't have to be getting their hands in the dirt. Indoor gardening activities may include things like seed starting or floral design. You could also have an educational talk about pollinators and raising butterflies. The cost can be minimal and still have a great experience for the residents. So some tips for success with accessible gardening: keep the tasks short. Allow people to change tasks every 10 to 20 minutes. And that's not only to prevent boredom, but also to protect their body from repetitive movement, allowing them to change positions periodically. Also, while teaching about gardening, teach good posture while gardening and making sure that the loads that people are carrying are reasonable and offering plenty of time for breaks. Some other tips for success: incorporate seasonal interest into your garden so that even during the dregs of winter, when everything can get a little bit dreary, plan for that by incorporating some ornamental grasses that will still rustle in the wind and even provide some color to break up the gray and browns. Incorporating a water feature is another way to include sound and other interest into the garden. So I invite you to think about your space and how accessible gardening can fit into what you are experiencing. think about the needs of the people in your program. What kind of movement are they able to participate in? What kind of sensory interests are already available, or what kind could be included? What is the communication level of the participants you're considering therapeutic horticulture for? Among a list of other considerations specific to your population where you are. Also considering barriers to a therapeutic horticulture program. Cost is an obvious one. Size and space, as well as location. Would you be able to put in a garden outside, or would you want to be gardening indoors? Would it be an active process or a passive process of therapeutic horticulture? These are all different considerations you would want to make before starting a therapeutic horticulture program. And finally, before I turn it over to Annie, I want to mention that there are funding opportunities for this type of programming. These are 3 examples that I found just doing a quick search. The National Garden Bureau does offer a therapeutic garden grant every year, which is preparing to open on the 1st of April. Grant Watch is a directory of grant opportunities. And then I also mentioned community partners. I've seen programs partnering with libraries, with elementary and high schools. There in food banks. There are lots of opportunities for that collaboration within a single community to benefit the common good. All right, Annie, I talked a long time, but here you go.
Thank you, Cynthia. Well, I'm Annie Baker. I'm our state coordinator for our Kansas Master Gardener program. And as we get ready to conclude our presentation today, and then we'll open things up to question and answer. So we've already got some information about someone's gardening plans coming up. Please put what you're working on in the chat or any questions, and we'll be sure to have some time for that. But we want to go over some case studies that really highlight some of the principles that Cynthia has just shared with us. Through some examples across the country, as well as leave you with some resources so you can, as you start to think about implementing these practices and principles and programming into your own locations. So here are 2 examples from Kansas that specifically were carried out with our Master Gardener volunteers. These are both in the Kansas City area. And one of the things that my Master Gardeners really wanted me to share with you as you're thinking about maybe incorporating volunteers into bringing therapeutic horticulture programming or garden spaces to different spaces like these assisted living facilities in Kansas is that make sure you include the residents of these facilities in with the planning. So along with the staff and along with their nursing team and perhaps horticultural therapists that they have on staff and their facilities staff, as we often know, working with partners, we get caught up in all of the planning, but bringing in the people who are actually be using the spaces is an important component. And my volunteers wanted you all to know that and how rewarding it is actually for the volunteers and for us ourselves to get to work with the residents directly through the development of these sites. So as Cynthia was talking about, developing these spaces is a way to help the residents promote that physical activity, independence, engaging in memories, and just building their self-esteem by being able to be outside or inside or on the patio and growing something. So at our Delaware Highlands Assisted Living Facility, the garden space, and this is pictured here on this slide, the garden spaces that they developed weren't very large. They were right up next to the building. They were carved out of the green grass lawn. Flower beds were put in, as well as some small vegetable garden spaces. And just having that to look out on from their rooms, we all know what that effect has on us and how important having green spaces around us does to lift our moods, even if you have that passive engagement. But these sites also being directly outside the building allow that active engagement. And so Master Gardeners are able to, not the Master Gardeners, the residents are able to come out and plant the produce on their own or with the volunteers, harvest that to bring inside. And in this particular site, the flower gardens were especially liked by the residents, and they were able to come out and do cut flower bouquets to bring inside for their cafeteria spaces or their rooms, as well as different types of arts and crafts. And in this space, our master gardeners, after development of the gardens, go in regularly to provide some therapeutic horticulture activities on a regular basis for the residents. In a little bit different example of a case study, can you go back one, Cynthia? At the Evergreen community, this is a community where the residents aren't always able to leave their rooms. They're in the final stages of medical care. And this facility has a unique design where their garden space is kind of enclosed in the center of the building, allowing a lot of the residents to be able, and their caregivers, to be able to look out onto that garden and receive some of the healing aspects without necessarily having to go into it. But also in this space, something that I thought was unique was the residents and the master gardeners often work alongside each other. So at this site, our master gardener volunteers or the staff aren't necessarily doing therapeutic horticulture activities on a regular basis, but the master gardeners are simply present in the space, going weekly for work days. And that often draws the residents out of their rooms and into the space, whether to just have a conversation with the master gardener as they work in the space, or to work alongside and do some of that garden maintenance together. And again, there's that strong sensory focus that you heard Cynthia mention a lot to elicit some of those memories and engage that creative expression and connection, whether through sight or smell or touch. So these were just two examples from Kansas, and we can go on to talk about a couple more from around the country. The Portland Memory Garden is so different from being a private, as part of a private facility. This healing garden is a public garden that was established in May of 2022. There's a really great website for this garden if you want to learn more about it, and a YouTube video with a tour of this garden out there. This was designed specifically for those with memory disorders and their caregivers. They had a pretty great team to design all of the features in this garden, including environmental psychologists, experts in Alzheimer's disease, and some horticultural therapists all came together. But it's an outstanding example of developing a healing garden for a specific audience in mind and for those healing properties. So one of the features is the garden is completely gated in, as well as having a circular design to, curb any confusion for the people walking around the garden. That circular pathway to all the visual landmarks to help them feel oriented. And also this garden raised up quite a bit of their beds. And we heard Cynthia talk about this. People that visit this garden aren't working in this garden, but they raise the plants up so that there doesn't have to be all the bending and the stooping down, and they can have the full effects of that sensory experience with the plants. In this one, there's also lots of, as you think of people enjoying a garden space, lots of places for resting, benches, places for shade, there's water fountains. And so this one we thought was really neat that they focused on just that specific purpose. And the other thing that they do here is that registered horticultural therapists from the community take other older adult communities tours for other older adult communities in the area of this garden. So not only is it for the public, but they use it for some programming as well. All right, a couple of our last two case studies here. This facility, the Care Plus Horticultural Therapy Facility in New Jersey, is an example of where instead of therapeutic horticulture, where we're enjoying it for some reasons, this is a very specific reason that the residents are using horticulture as part of their care regimen. And so residents here are adults ages 30 years or older and often need very specialized care for complex physical or cognitive or psychological challenges that they have. And their daily care regimen is overseen by health professionals, including registered horticultural therapists. And these activities are part of their care. And so they have a greenhouse at this facility, and those horticultural therapists are working with the residents in that greenhouse on a regular basis as part of their care. And this facility also uses, I should say, most of the facilities we are sharing youth volunteers as part of bringing these programming to the adults there. In our final example, we have the Edgerton Hospital in Wisconsin. And that's the picture here you see on the slide, with an outstanding hospital campus, 7 acres of a healing garden. This garden is 12 years old, and they have a great YouTube video as well, so you can get a tour from the facilities manager of this site, and are expanding this garden. And in fact, this garden is open to the public, not just patients or caregivers visiting the hospital. And it actually connects to that 25-acre forest that you can see there in the background. And so these trails and gardens can be enjoyed by the community. And this one is very, very full of all of the sensory things that Cynthia was talking about. There's ponds and waterfalls for that sound feature. They have a pollinator garden where they're attracting lots of movement through the insects that are visiting the flowers. And of course, there's a lot of great fragrance and things there for that. They were really proud to talk about the frogs in their pond as part of that auditory experience, something I love. And a lot of us do. And then just lots of color. And so they have themed gardens throughout the 4 seasons that are able to bring color or shape or movement from the wind here. And again, this one has a lot of those wide paths that you can see, a lot of accessible seating, so it can be enjoyed by people of all ability levels. And they also, in this one, like our first 2 examples from Kansas, bring in those raised beds for produce and growing vegetables, and those are actually used in the cafeteria and in the patient's meals, the things that they harvest here. So we hope that you've enjoyed, hearing about some of these principles and some of these examples of how gardens can create that active and passive engagement, that strong sensory focus. And really, with therapeutic horticulture and horticultural therapy, we are focusing on the participants and what their needs are. So whether or not you have access to a healing garden, a therapeutic garden, or spaces where you can have container plants or the other methods that Cynthia talked about, we didn't want to leave you feeling like you couldn't start doing something right away to bring therapeutic horticulture into your programming. And this is a resource that Cynthia and I attended a webinar on ourselves from the collaborators of this new resource that was launched in 2024 called THAD, or the Therapeutic Horticulture Activities Database. We were just super excited to find this because there's over 200 horticultural-based activities in this database. It's completely free and it's online. It was developed in partnership by horticultural therapy practitioners from various networks in North America, and it's being housed in partnership on the University of Florida's Environmental Horticulture website and a part of their certificate in horticultural therapy. And Cynthia, thank you, Cynthia. So in contrast, when we talk about horticultural therapy, which is care that's provided by that registered horticultural therapist professional with specific, cognitive, physical, or social goals as part of a person's medical care regimen, that's something that we aren't able to do unless we ourselves are registered horticultural therapists. Therapeutic horticulture is something that any of us can do, and that is the intention of this database, that any type of educator could bring therapeutic horticulture into their programming. So they wanted me to emphasize that this is not just for horticultural therapists, although if you are one, you can use this, but also extension professionals, your volunteers, your master gardeners. Share this with activity directors at assisted living facilities, and just other educators interested in this topic. And a really strong part of this database is their ability to search. So not only are the activities, when you go to this database, presented to you in that really concise 2-page format, makes it very easy to follow and implement an activity quickly for a program, or share that with your volunteers to be able to pick that up. It lists the therapeutic goals of the activity, and you can also search for those goals. So for instance, are you approached by a group that's interested in working on some sensory goals or some social goals or emotional, and you can search activities by the goal. You can also search activity by population. So if you'd like to bring an activity to an older adult group or a group with physical disabilities or other mental health conditions, you can search for the population feature. And you could also just search by activity type. So are you looking for an arts and crafts idea? Are you looking for a harvesting idea, planting, cooking, something in nature? So all of these, this database makes it really easy to search through for that. So we hope that you will definitely visit this website and use these activities. The collaborators wanted me to share that they're still adding activities to this database. They would be more than happy to hear from you. How did the activities go when you implemented them? Do you have activities you would like to add to the database? So I should mention that what makes this database special and what makes it for us to know that these are actually therapeutic horticulture activities is that the group of collaborators who created this vetted all of these activities. They were developed, designed by horticultural therapists, and then tried and tested to making sure that they were meeting the intended goals that they said. So if you need to know that not all of the plant-based activities we do are therapeutic horticulture, but the activities in this database, you can be sure are reaching those therapeutic horticulture goals. All right. So with that, back to Cynthia's great reminder of how gardening is for everybody and thinking about personally for us, for our families, as well as for the clients and partners in our communities that we're working with. We hope that you get a chance to incorporate more of gardening and using plants in your programming. We'd like to leave you with a few resources in addition to the FAD database. If you'd like to stay in touch with Cynthia or I, we encourage you to use this email address here, hortsupport@ksu.edu, to keep in touch with us. Cynthia produces a weekly newsletter through Kansas State University, our horticulture newsletter. Not only does she share tips and tricks of what's happening in the season, what types of plants or activities you should be doing in your garden or your spaces at that certain time of year, she also has a good focus on community gardening ideas, school gardening ideas, therapeutic horticulture gardening ideas. So we hope that you would consider joining our newsletter or just reaching out to us if you have any questions as you begin to work on projects. We also wanted to show you where K-State houses our horticulture resources and encourage you to look to your land-grant university, where are there, and become familiar with their horticulture resources and master gardener programs and other faculty and extension staff that are your horticulture professionals that you all work with. If you'd like to see an example of K-State's, we encourage you to visit our Horticulture Resource Center. Again, all kinds of things that you can search for, common plant and pest problems. All of our K-State research and extension horticulture publications are here, and recommended plants for our area. So if you share a similar climatic zone as Kansas, some of these resources would be applicable to you as well. But we also just encourage you to reach out to the horticulture staff at your universities. The most popular publication that we have right now, as far as for our Kansas resources, is our Kansas Garden Guide. This is free for download. You can use the QR code, or we'll give you a link to this in the follow-up email from Erin with the recording of today's topic. And we encourage you to use this guide or just browse this guide. It's one of our most popular in Kansas. So with that, we can answer any questions that we have. And we all thank you for being here today and would love to hear more from you after today's presentation.
All right, thank you. If anyone has questions, feel free to pop them in the chat or unmute yourself. I see there was one question in the chat from Liz. Annie, did you want to read that one?
Sure. Yeah, Cynthia, this is for you. So this is from Liz Murphy. Are there common conflicting access needs you encounter when creating accessible gardens? And if so, are there thoughts on dealing with them equitably?
So what's tricky, let me see, I see my phone or my computer blinking. What can be tricky about accessible gardening is that there is such a variety of participants. So we are going to be talking, excuse me, primarily about that older population. So I'll talk about accessibility in those with that regard. One of the things that tends to be a challenge with accessibility is locating the garden when we're talking about like a traditional garden in ground, having it be close enough to the facility or the site, the residence, so that it is physically possible for participants to go and participate. I know specific for like my grandma said that her site has a garden, but she can't walk that far to get to it. Or if it's a warm day, which may be ideal for a garden, it's uncomfortable to have to walk that far out there. So I think that the biggest consideration that needs to be made with regards to accessibility is the logistics of actually being able to access the space. The plants are important. All the different styles of gardening are important, but remembering that making it so that people can actually get to the garden is really is something that's surprisingly overlooked sometimes.
Perfect. Liz says thanks. And we also had one other person in the chat, one of our Kansas Extension agents, who said they're developing a new community garden in Western Kansas. So Monica, we've hoped to hear from you more about how that goes in your area. So thank you for being here today. All right. Well, Cynthia and I welcome you to keep in touch with us and email us for anything that you need. After today's presentation, feel free to share the recording of this with any colleagues, and we appreciate you being here.
Thanks, everyone. On behalf of the North Central Region Aging Network, thank you to our presenters for being with us today and providing this excellent information. I know I learned a lot. I was particularly impressed by your son's vertical garden made out of the weed mat. That is so neat. That one really stuck with me. So thank you for all of the great information. And I see Liz saying in the chat, and then with Monica as well, that this information is so applicable to the work that extension agents and their community partners are doing in communities. So this is wonderful. I did put the link to our webinar evaluation in the chat. If you have a couple of minutes to complete that, that just lets us know how we're doing and what other things you would like to learn about and see offered from the North Central Region Aging Network. And next month, I had to double check, but the first Friday next month is also the 7th. So March 7th. We will have a presentation from Michigan State University on loneliness and the impacts on older adults. So we hope to see you next month. And please do get in touch with Annie and Dr. Domangini if you have any additional questions. And thank you for attending today.